Let's talk about skincare routine during pregnancy. I'm Dr. Brown. I'm board certified medical and cosmetic dermatologist and a mom of two. By the end of this video, you should feel confident in taking care of your skin safely. These three conditions are extremely common during pregnancy: skin sensitivity, such as rashes, irritation, dryness, acne, and melasma. And melasma are those brown patches that show up in typical patterns, such as the cheeks, forehead, or even upper lip area. Now that you know the three very common conditions during pregnancy, let's get into each one of those and which ingredients you might want to avoid while treating those and which ingredients are going to be helpful. A couple of things you may want to consider stopping. One is retinol. If you're using any sort of retinol, tretinoin, adapalene gel over the counter, or tazarotene, you need to stop those immediately. To be safe, I would just stop them if you're trying to conceive. Another ingredient I would consider stopping is anything with salicylic acid. Cleansers could be controversial, but anything that's a leave-on salicylic acid product, I would stop that immediately after you find out that you're pregnant. So number one, sensitive skin. Why is your skin sensitive when you're pregnant? Well, hormones are changing. Your estrogen is not what it used to be. Your progesterone is not what it used to be. It affects not only your mood, but your skin too. While some women experience more oily skin and more pigment and more acne, there's many who are just really dry when they're pregnant. If dryness and sensitive and irritated skin are your concern, here's some tips. When washing your face, don't use hot water. Hot water is going to strip all the oil from your skin. If you're dry to begin with, you're just going to make it worse. So lukewarm water will be very helpful. This is extremely important in the winter months in the shower. It is instinct to wash your face with the shower water, which is really hot. So try to use lukewarm water on your face. So for face washes, I typically recommend hydrating cleansers. These typically don't foam up very good. So if you're somebody who wears makeup or really heavy sunscreen, you might like something that says cream to foam cleansers. CeraVe makes a really good cleanser, hydrating cream to foam cleanser that not only hydrates your skin, but it also foams up to remove all that dirt, oil, and sunscreen from your face. And if you want more product recommendations, just a reminder, I'm going to link them below. Next important thing for the sensitive skin is to apply moisturizer. The best time to moisturize your skin is within 3 minutes of getting out of the shower. So while your skin is still damp, just a plain moisturizer. I love things like CeraVe, Cetaphil, or La Roche-Posay moisturizers. Make sure you apply within 3 minutes of getting out of the shower. Next condition common in pregnant women is acne. And this can be just your typical acne that you get on your cheeks or forehead, but for a lot of women it's hormonal acne, which is cystic, jawline, and can be painful. If you're pregnant and suffering from acne, one easy thing you can do is a cleanser with benzoyl peroxide. These are generally considered to be safe during pregnancy. Benzoyl peroxide is an active ingredient, so make sure you check the back of the bottle. One brand that I find really good for sensitive skin with benzoyl peroxide is a CeraVe Cream to Foam Cleanser. It has 4% benzoyl peroxide, and it's very good for even the most sensitive skin. Now, I do find the 10% CeraVe product to be just a little bit stronger, so if your skin is extremely sensitive, maybe start with 4% before you move up to 10. When using benzoyl peroxide cleansers, remember you have to leave it on for a couple minutes before rinsing. If you've used it for 2 to 4 weeks and your skin is not responding or you're developing cystic acne, please see your dermatologist, because if you see your dermatologist, we have several options of prescription medications which are safe during pregnancy. Treating melasma can be challenging, but treating melasma during pregnancy is even more challenging. Melasma is a chronic, ongoing condition that we don't really fix, we mostly manage it. So making sure that you're staying on top of it and doing things to prevent it is extremely important. The most important and safe during pregnancy step you can do if you suffer from melasma is tinted sunscreen every single day. Now, next thing that I'm going to say can be argued and can be controversial, but I personally love mineral sunscreens. Mineral sunscreens tend to be less irritating and more appropriate for pediatric patients or those suffering of sensitive skin. Those are things like zinc oxide and titanium dioxide. Chemical sunscreens contain other chemicals such as avobenzone, and they work by releasing heat and sometimes can flare melasma and can also cause irritation to very sensitive skin. So for that reason, if you're pregnant and suffer from melasma, not only would I make sure that my SPF is at least 30, preferably 50, I would also make sure that it's mineral. That means it contains zinc oxide and or titanium dioxide. And I would also make sure that it's tinted. You have those 3 things. The only thing you're missing is that you like it and you'll wear it every single day. Another simple step that you can do over the counter is vitamin C in the morning before you apply your sunscreen. It will help increase the potency of your sunscreen. It will help with your melasma. A lot of melasma treatments are only available by prescription. They're not safe during pregnancy, so be very careful what you're using. And 2 other ingredients available over the counter that I want to briefly mention that would help with melasma if you're pregnant and are safe are things like glycolic acid and azelaic acid. Let's say you're pregnant and you have 1 or 2 or all 3 of these dry, sensitive skin, acne, melasma. What do? How do you put it all together? Here's a simple routine. Wash your face, definitely at bedtime. Morning's optional. Use creamy or cream to foam cleanser, something that says gentle or sensitive skin. Definitely nothing with active ingredients. After washing your face at bedtime, moisturize with a plain moisturizer. If you suffer from acne or melasma, this is when you can apply one of your actives prior to applying moisturizer. So if you suffer from melasma or acne, you would use your azelaic acid. If you suffer from melasma, you can use glycolic acid. Be cautious with this one. I would only use it once a week. In the morning, after washing your face or rinsing off with water, I would apply vitamin C and then your sunscreen. Thanks for watching. Like and subscribe to the channel for more. Follow me on Instagram and TikTok at Dr. Alexandra Brown. Let me know in the comments below if you have any other topics along motherhood, pregnancy, breastfeeding, or kids that you want me to cover. Catch you next time.